What we are introducing today is a bill that will create a unified personal health premium account. Let me describe that for you briefly. This is an account into which multiple sources can contribute funds to help an individual pay for a health insurance premium. Right now, for example, if you're underemployed, if you're a part-time worker, you're a small employer employing that part-time worker, typically you're not offering coverage to your part-time employees because you can't afford it. And small employers more and more are finding it difficult to continue to provide group coverage because of large increases in their group insurance premiums. What we have created now is a fund into which maybe one or two employers, part-time or small employers, could contribute some money, not the total cost of a premium, but something towards somebody's health insurance premium. Maybe the state helps provide some subsidy, like we're doing with the Healthy Minnesota Contribution Program. Maybe a family member is able to contribute towards that, perhaps a charitable organization. And this now becomes a tool for creating enough resources for somebody to afford a private individual insurance policy.
We believe that this is an important step for the people of Minnesota to see that we believe that we can solve the problems that we face in insurance affordability, portability, accessibility with a Minnesota solution, a free market solution.
And that Minnesota already does so well on its own that it doesn't need the federal exchange proposal that can do that.
Some of this is kind of an ideological viewpoint, that I won't, that it's hard for me to argue against if you're dead set in that you don't like the idea that the federal government is involved in health care coverage. So I just don't know how to argue against my colleagues against that issue. But I will say this, we should have the argument. We should have it in public. We should have a hearing. We should talk about this so that Minnesotans can hear it and that we're not necessarily standing in front of you kind of debating this with them out of the room. That's the process. That's what you send us here for. I'll say this. We just heard from Abby, who has a pre-existing condition. Minnesota didn't tackle that issue. They didn't deal with pre-existing conditions. They didn't first develop the process in which her parents can have her on their insurance until she's 26, and then the full implementation of the bill that we don't look at pre-existing conditions and still give her the coverage that she needs. And I think we saw how bright and articulate and smart that she is, and that's because we have great health care that we deliver, and we want to continue to deliver it for everybody. And so I think that, part of our issue and the problem that I have, quite frankly, from going even from the House to the Senate, is that I know, and I didn't hear the full press conference of Senator Hand, but it sounds like he may be inclined to give it an informational interview. Well, why not a full hearing? Why not a full hearing? Let's debate them. Let's look at this proposal. Let's look at Senator Lori's and Representative Atkins' proposal. And frankly, if Senator Hand or Senator Gottwald or anybody else in this body has a bill, let's hear it. I think we're going to hear, his proposal. So I think the power of the gavel is important. But he also has a responsibility to Minnesotans so that we can hear this in the public in a full debate.